Good morning, everyone. My name is Deqi Fang. There are my teammates Lim Lizi, Lim Qianyi, Lim Rongqi. Today, our topic is cardiovascular disease. Cardiovascular disease is the leading cause of death globally. In 2022, it caused approximately 19.8 million deaths, accounting for about 32% of all deaths worldwide. Among these, 85% were due to heart attacks and strokes, and over 75% occur in low and medium income countries. In Malaysia, cardiovascular disease remains a major health concern. Data from 1991 to 2024 show that ischemic heart disease, a type of cardiovascular disease, is the leading cause of death. In 2024, it ranked as the #1 principal cause of mortality. Studies also indicate the overall cardiovascular disease mortality is similar between male and female. However, males have higher risk of premature death from cardiovascular diseases. In addition, more than 25% of male and nearly 21% of female have hypertension, while 1 in 3 adults have high cholesterol, both of which significantly increase the risk of cardiovascular disease. According to a study on the prevalence of high 10 years cardiovascular risk among the general population in Malaysia 2022, 21.4% of the adult population is classified as having a high risk of cardiovascular disease.
Now, let's start by looking at the system itself. The cardiovascular system is a dynamic transport network. It's made up of the heart, arteries, veins, and capillaries. Its primary job is to maintain tissue perfusion and keep the body in a state of homeostasis. As you can see on the diagram on this slide, this is a highly complex but efficient delivery system. It operates through two main pathways. First, the pulmonary circulation, which oxygenates blood in the lungs, and second, the systemic circulation, which delivers the freshly oxygenated blood to all the tissues in the body. So where does cardiovascular disease start? It begins when this normal structure and function are disrupted, most commonly by atherosclerosis, hypertension, or endothelial dysfunction. Endothelial dysfunction is the initiating event. Damage to the endothelium, often caused by smoking or high cholesterol, reduces nitric oxide production and creates a pro-inflammatory thrombotic state. This damage leads to a cascade of events. LDL cholesterol accumulates in the vessel walls and becomes oxidized, triggering inflammation. Macrophages then engulf these lipids, forming foam cells, which leads to plaque formation and arterial narrowing. Finally, if that plaque ruptures, it causes thrombosis, leading to acute events like a heart attack or stroke, and ultimately reducing blood flow and ischemia.
Hemodynamic alterations are a key feature of cardiovascular disease. Increased vascular resistance, such as in hypertension, and reduced arterial compliance, meaning stiffer arteries, make it harder for blood to flow. This impairs cardiac output and places chronic strain on the heart and blood vessels. In response, the body activates neurohormonal systems, especially the sympathetic nervous system and the RAS. In the short term, this helps maintain circulation by increasing heart rate, causing vasoconstriction, and promoting fluid retention. However, long-term, these effects become harmful and drive cardiac remodeling. Inflammation and oxidative stress also play a major role. Reactive oxygen species damage the endothelium, trigger inflammation, and make plaques more unstable, increasing the risk of rupture. Chronic pressure or volume overload leads to structural changes in the heart. Hypertrophy occurs initially, but this progresses to fibrosis, dilation, and reduced contractility, eventually resulting in heart failure. At the cellular level, cardiomyocyte death, mitochondrial dysfunction, and impaired calcium handling will further reduce the heart's ability to pump effectively, contributing to ongoing cardiac dysfunction.
Cardiovascular disease includes major conditions such as myocardial infarction, stroke, peripheral arterial disease, and angina, which affect the heart and blood vessels. Common symptoms include chest pain that may radiate to the arm or jaw, shortness of breath, fatigue, and dizziness due to reduced blood flow and oxygen delivery. Lifestyle modification is essential in managing cardiovascular disease. Patients are encouraged to follow a healthy diet rich in fruit, vegetable, whole grains, and lean protein, while avoiding saturated and trans fat. Regular physical activity of at least 150 minutes per week is recommended. In addition, smoking should be completely avoided. Body weight should be maintained within a healthy range. Alcohol intake should be limited, and both blood lipid levels and blood pressure should be well controlled. In terms of dietary guidelines, total fat intake should be around 25 to 35% of daily energy, with saturated fat limited to less than 7 to 10% and trans fat below 1%. Carbohydrates should make up about 45% of energy intake. Recommended dietary patterns include the Mediterranean diet and DASH diet, which emphasize fruit, vegetables, whole grains, healthy fat, and lean protein sources. For food choices, patients should consume vegetable, fruits, legumes, whole grains, fish, and plant-based oil like olive oil. Foods to avoid including alcohol, high saturated fat food, deep fried item, red meat, and excess salt above 5 grams per day. And this is the example of menu of cardiovascular disease. And this is our reference. Thank you for watching.